is WVVA in Focus, a weekly program about important issues and events in the two Virginias.
Good morning and welcome to this edition of In Focus. I'm your host, Melinda Zosh. So this morning we're going to be talking a lot about a local hospice agency. Joining me now via Zoom in Bramwell, West Virginia is Michelle Cook. And Michelle is a hospice liaison with Amedisys Hospice. And Michelle, again, thank you for joining us this morning.
Yes, it's a pleasure to be here. I'm excited to be able to share some information about hospice with you today.
Yes, absolutely. And it's a really timely topic, especially with COVID-19. We'll get into that in just a bit. But Michelle, for those who are unfamiliar, what is hospice? What does it do?
Hospice is a special kind of care that we're allowed to do in the home or wherever the patient is. Whatever the patient calls home is actually where we show up to do service. That service is provided for patients who have what we say or we call a terminal illness, which means an illness that's not going to be reversed. And if it continues to decline, then the physician will say that the patient has less than 6 months of life left. However, that is just a criteria that we're meeting. It doesn't have to be 6 months. It can be longer, of course. And we do have many patients who live much longer than that.
And Michelle, tell us more about Amedisys Hospice. Where is it located? And tell us more about your agency that you work for.
Sure. Amedisys Hospice is located in Bluefield, West Virginia. Our office is actually on Airport Road in Bluefield. But we are able and are privileged to be able to serve both McDowell, Wyoming, and also Mercer County. So we're a little bit of everywhere.
And can you tell us more about the services that your agency provides? Is it in-home care? Do they stay at that facility, or is it a mixture of both?
It's a little bit of both. Again, our program is very customized based on the need of the patient and the family. There are inpatient hospice availability that we hear of quite often, but there's also at-home availability and also the just wherever the patient is. Long-term care, we do hospice there. We do hospice at the hospital. We do hospice in the home. So it's actually wherever the patient is. We meet them there.
And Michelle, can you touch more on that team-oriented approach and how that helps people's physical and emotional needs?
Yes, our team approach is it allows us to customize the plan, again, based on the family and the need of the family. We offer case management, which is our RNs that are going out to check on the patient. We also have LPNs, we have aides, we have our own chaplain, our own social worker. And one of our programs that continues to go a month, 12 months actually, after the patient actually passes is our bereavement program. So we are there to meet the need of the patient no matter what that need is. So that keeps us, all families have a different need, and we're there to make sure that we can meet as many and as much need as that family and patient has.
And Michelle, you just mentioned the bereavement program. Can you touch more on that and who that would impact?
Yeah. Sure. The bereavement program is actually a program that is meant to help the patient's family versus helping the patient. At the end of life, of course, there's so many whys and what ifs and those kind of things. And patients' families are mostly not ready to talk about that at that time. However, life goes on and people forget that maybe this is the first birthday that this family has had without their mother or the first Christmas. And our bereavement team is there to be with that family, whether it be phone, whether it be in person, whatever they need, 12 months. So we go through the first everything with that family after the passing of the patient.
And Michelle, who pays for the service?
The service is paid for by insurances mostly. Medicare is a great provider of hospice care, but we do also private insurances pay as well. So it's an insurance paid program that keeps it. And of course, Medicare making the criteria and us simply following the guidelines.
And about how many people are helped by Amedisys?
Hundreds a year. Hundreds of people are helped. Patients that are served for, some patients we have only a short amount of time. They still get the 12-month bereavement no matter how long we have that patient. Some we meet at the hospital and there's hours left of life, and some we have actually had the opportunity to serve for more than a year. So it's actually the service is available to anyone who qualifies, and that is our goal today, is to let people know that there are an option to stay in your home.
And what's the average length of stay for a patient then?
More than 275 days. That is not uncommon for us to see a patient that is on. We also have patients that we discharge simply because they improve and they no longer need our service. So we call those hospice graduates, and we're certainly very happy to do so. So it really is about where you are today, what your health looks like today, and what your needs are today. And then we recertify those patients as we go on, and certainly keep them and provide service as long as they qualify.
And Michelle, you've shared some statistics with me, and these statistics say that hospice patients live an average of 29 days longer than patients with the same disease who do not have that gift of hospice. So can you touch on that and why that is that they live a little bit longer?
Absolutely. No matter where we are, when we get introduced to the patient and the family, there's one thing that we ask, and that is what matters most to you. What matters most? And so that patient has a lot of things that matters most, but it's usually 90% of the time is, I want to go home. I want to be with my family, and I want to be home. Any patient, all patients do better at home. We all do better when we sleep in our bed and we're surrounded by people who love us and people that we love. You take us, for instance, we're not even sick today, but I bet all of us were looking forward to getting home this afternoon. So patients do live longer in those at home than they do facilities. It's a proven fact, and a statistic stating that they do live an average of 29 days longer than a patient who is getting treatment and are not in the home. So I think that's a wonderful thing to know.
Yeah, that's definitely a good statistic to know that they live a little bit longer. And let's touch on COVID a little bit more. How has COVID impacted what your agency does and the patients? How are they reacting to the COVID then?
Patients are hesitant to leave their home at all in this time. Very much so. They really do not want to go to the hospital. And, you know, with everything that's going on now in the hospital, one, we have a problem with where are we going to put the patients? The room, the patients are so sick, and we have such a pandemic going on right now that patients are actually afraid to go to the doctor's office or to the hospital or anywhere else to seek care. So they are deferring care because they do not want to take a chance on what's going to happen once they get there. So we are a great match for those folks who simply don't want to. They choose not to go to the doctor during the time.
Then would someone need to have a terminal illness then to go to hospice? Is that one of the requirements, or what are the requirements for the hospice care?
One of the requirements, and the big one, is based, like I say, Medicare makes our guidelines and we simply follow them. But the one thing that it says is that the patient is terminally ill. And that word terminally is very scary. But if you really think about it, it just simply means that the disease process can't be reversed, such as, say, COPD or heart disease or anything like that, when physicians have done all they can and they're simply maintaining what that patient's going through. So it doesn't have to be that scary terminal word that turns us all off to hospice. It simply means that there is no treatment available, or the patient simply chooses not to have treatment. And that's when we start the process of qualifying a patient for hospice care.
All right, I want to touch more on that coming up. We do have to take a quick break, but I want to touch more on those qualifications and how folks can get in touch with you. Stay with us. We'll be right back after this. Good morning and welcome back to this edition of In Focus. I'm Melinda Zosh. This morning we're talking about hospice care and a local agency called Amedisys. And we've also been talking about how COVID-19 has impacted the way patients are perhaps hesitant to go to the doctor's office. Joining me now once again via Zoom from Bramwell is Michelle Cook. And Michelle, thank you. You've been sharing some very valuable information with our viewers this morning. Let's talk more on the subject of COVID-19. And you were talking more about terminal illness and what that definition is. But you mentioned that folks who have COPD or maybe even heart disease could perhaps qualify for hospice. And can you touch more on that and how they would get in touch and go through that qualification process?
Yes, anyone can make a referral to hospice. It is just simply picking up the phone and giving us a call and saying, hey, I know someone or my loved one doesn't want to go to the doctor. We're having trouble getting refills on a much needed medication. And that is all it takes, just to call to our office, and we will begin to do the legwork behind the scenes to see if that patient qualifies. We'll stay in contact with you, let you know what to expect, and certainly walk through that process with you. We'll get involved with your physician, with the medical records, and see what we can do. We have our own physician, our own nursing staff, and it's 24 hours a day, 7 days a week, 365 days a year. So if you're sick on Thanksgiving or Christmas and no one else is around, guess what? We're working. When we're going home, we have one shift going home and another shift coming on. So we're constantly doing care for patients that are out there. We have pharmacies that will go in and get medication for us if we need it. We're just a specialized care for a patient who is really in need of being at home and does better at home. So that's how you do it. You just give us a call at our office, and I'll go over that with you a little bit. But we are seeing so many patients, some calling themselves saying, hey, can I come on hospice? We've not seen that before in our time, so this is brand new for us. But truly, none of us know what the winter's going to hold. It's very unknown. We really have no idea. So if you can stay home and know that at least you don't have to worry about that and receive the medical care that you do, we help you with equipment, beds, oxygen, things such as that. That's also covered in our plan. Medications, keeping those refilled for you, that's in our plan. So we can do so much to help you stay at home if that's what you want to do.
And Michelle, what's the best phone number for folks at home who are watching? Maybe they do have someone that they'd like to refer to hospice, or maybe someone's watching and think they might qualify. What's the best phone number to reach Amedisys at?
I just ask you can give me a call at my company cell phone, 304-208-1314, and I'll be happy to come out and sit down and talk with you, share our program and what we do, see how it matches up with what you already have going on in the home. And that's what we do as liaisons. We stand between the physician and the patient in making sure that hospice can work for the family and for the physician. So that's what we do every day. It would be my privilege to come out and talk to you. Call me on the phone and we'll see if you qualify.
All right, great. Thank you for sharing that, Michelle. And you did touch on some of the services that Amedisys offers. What would you say is the most important service or services that your agency offers for folks?
I really think it's more than a service. I think it's the care. I think just having someone on board that is a life coach that can say this is normal, this is abnormal, and just be able to talk to people who are sitting at 2 a.m. beside someone who's not doing well and be able to coach them through. I think our service is, our best service is our employees. I think that our hospice team is the absolute best anywhere that I know of. They are there with heart. And, people ask me all the time, how do you do hospice and not just cry all the time? Well, the truth of it is we cry a lot because you don't get in there and get to know these families. They open their door and let you come in. You become part of their family. And when that day comes, when that patient passes, it hurts all of us. It really does. But I really say that we provide so many great services, but our number one service is our staff.
Yeah, and it sounds like your staff really does care and they get really close to those patients that you help, and that's really touching too, that these folks do need that help. And why do you think having this hospice care here in our area is so crucial? I know West Virginia does have an aging population, but what about having it here in southern West Virginia? Why is that so important?
I think it's very important because our area has very different needs than other areas. That is, transportation is a need. When you no longer can ride a car to your doctor's office, you can't get there physically. You don't feel like going there, and all of these things that are going on. We are so limited with specialists that many times these patients, when they do go through the ER, they end up in other states. I mean, we see patients that are from our counties, Mercer, McDowell, and Wyoming County, and they end up in Tennessee, they end up in Kentucky, they end up a very long way from home. Now, remember, during COVID, your family cannot go with you. So these patients are gone, and they don't even really know where they are. We get calls all the time from other referring hospitals saying, we have, a patient, and they're very, I mean, I'm telling you, we have patients come from Pikeville, we have patients come from a lot of places. So that is the number one thing. Going to the ER is only part of it. It's how do you get home? That's the number one thing. You can go, but if they may or may not be able to treat you. Right now, our hospitals are on diversion, which means they can't accept any other patients coming in because they're so full. So you're very likely your patient or your loved one is very likely to end up very far away from home. So that's one of the benefits that we have to being an alternative to going to the hospital, and that is receiving your care at home.
Right, because as you mentioned, it's a hassle to travel far away, and COVID-19 has changed the way visitation works at various facilities. So being close to home is definitely a strong point there. Now, how has COVID-19 also impacted you and the other workers with Amedisys?
We screen this week. We're screening once this week because our code status has changed, color status. But our staff is COVID testing twice a week. We are wearing PPE gear all the time. We're all wearing masks and shields and gowns and doing all of that. We're also calling before we go, making sure that person or our patient or the family has not been out of the country, that they're not having a fever, that they're not sick, things like that. So we're following the same protocol that they're following in the hospital to be able to get into these homes to care for these patients. And some of our patients with Alzheimer's, it is a great reaction to see them when we show up, masks, goggles, gown. You have to explain to them over and over because they have no idea what's going on outside of their world. And to see people look like that is kind of strange. So again, that staff is doing a phenomenal job getting out there, caring for those folks who have not seen days like we've been seeing in the last while.
All right, well, Michelle, we have to take another quick break, but I do want to talk more about the patients and why they're worried about going to the doctor right now amid COVID-19. We touched on that a little bit. I want to talk about that more in depth coming up right after this. Stay with us. We'll be right back.
Sure.
Welcome back to this edition of In Focus. This morning we're talking all about hospice. So we've talked about what hospice is, who can benefit from it, and we've also discussed how COVID-19 has changed the way hospice workers are doing their jobs, and also about patients as well. Joining me once again is Michelle Cook. She's a local liaison with Amedisys Hospice in Bluefield, West Virginia. And Michelle, earlier you touched on patients just not wanting to go see their doctors, and that might be exacerbated also with the winter weather. Can you touch more on that and the changes you've seen since the COVID-19 pandemic actually started earlier this year?
Yes. One of the things, especially patients who are a good indicator that they qualify for our service, is patients who need maintenance medications. And that means when they go to the doctor, there's not a lot that can be done to fix the condition that they have. So they need these maintenance medications. Some of them are breathing, some of them are whatever the condition is. And the patients getting in to see their provider and being able to get there and get the refill has really become an issue. They do not know, our elderly population is not familiar with what goes on outside. All they have is what they hear, the news and whatever that they're seeing on there. So they are really reluctant to leave their home for any reason. Patients that will not even leave to go get groceries is certainly not going to leave to go to a physician's office. So we have now the physicians who have to see these patients. I mean, they have to see them in order to refill these medications. And the increased volume of calls coming into the physician's office saying, could you refill my medicine, has become a problem. We talk about this quite often out in the field when providers are saying we're seeing less and less patients. They're just simply not coming in. And of course, the fear of what's going on, the fact that they're in that population that makes them very susceptible to the COVID virus. So they are simply choosing to stay at home versus taking a chance on what they might encounter when they leave their home.
So how do you think hospice care could be a solution to those people who are afraid to leave their homes? How could that be maybe one possible solution?
A good solution for them would be, and what we can do for them is our physician who is would be their hospice care physician at that point, is able to keep those maintenance medicines prescribed. Our hands-on nursing team is able to monitor the patient, do their vital signs, make sure they're doing okay. We call that into the pharmacy. The family goes and gets that medication, and that eliminates fear, especially for our patients who have a real hard time breathing with COPD or whatever. Nothing makes it more difficult to breathe than anxiety. When you get nervous, you can't breathe. When you can't breathe, you get nervous. It's a vicious cycle. So we're seeing more and more of that when the patients have to worry about how we're going to get our medicine. We can bring the answer to their home. They do not have to leave their home. We bring medicine to them, and that is what changes everything about our service. In home health, people are much more familiar with home health. They simply are there to help patients meet goals and to obtain a goal of some sort, which is making them improve. Our world is much different. We serve patients who does not have the ability to improve. So we're actually just doing comfort care, keeping them keeping them comfortable, keeping them at home, and meeting the needs that they have while being at home with their family.
And Michelle, what does your role of hospice liaison consist of? Can you describe your job duties and how long you've been doing this and how you got into the field?
Yes, my job as a liaison is simply standing between that referral or that physician and talking to them about this patient, educating end-of-life care to our medical team, to families, seeing what the needs are, working with our clinical team to make that transition smooth to come into hospice. We do that every day. This is what we do. It's our specialty. And I've been doing this for many years. I took a break for a while and did some other things, but hospice has been my passion since the day I was introduced to hospice. After being in the medical profession for a good long time, I found myself in need of hospice. My grandmother was very ill, and I found myself in a social worker's office with my mother trying to make a decision because we thought hospice was simply going to actually be there until they died, and we didn't know. It seemed like 3 days, that was the magic number people had told me. But the choice was my grandmother wanted to come home. She did not want to go to that hospital and stay like she had been doing. So the only choice that we had to bring her home was to bring her home with hospice. And my goodness, it has been the greatest gift that I've ever known about. And it is a privilege to get to bring that gift of hospice to families every day. So if you're home and you're thinking, oh my gosh, maybe we qualify, why don't you just give me a call and let us see if you can qualify? We do not hasten or hinder the dying process. We are not there to make it come quicker. And Lord knows we can't stop it, right? I mean, we all know that we're not in charge of that kind of thing. So we just simply work on making every day the best day that it can be for the family and for the patient.
And we have just a few minutes left in our segment, Michelle, but why do you think that hospice is described as a gift? And thank you for sharing that personal story about your grandmother as well. But why is hospice a gift, and what feedback have you received from family members?
The gift of hospice is much farther than any person can understand until they've experienced it. Our patients, who are the people that really know our story, aren't here to tell us the story. So the people who do tell us what they think about our service is the family that we've dealt with. After the patient passes away, we send out a card, and it's like a little report card, and we say, how did we do? And what we hear patients say families say over and over is, I wish we had known sooner. I wish we had been able to have hospice before we did. And that is our goal, is to let people know you do not have to be dying right that minute to get hospice. Hospice is simply there for the family and for the patient. So it's a very personal gift, a gift that you will absolutely enjoy and be able to keep that patient at home.
And Michelle, can you share your cell phone number again for folks out there? Maybe repeat it twice, yes, just in case they need a paper and pen to write that down. I think that's important for them to give you a call if they're interested.
Yes, the number is 304-208-1314. and that is Amedisys Hospice. And my personal number, where you get a hold of me, is 304-208-1314, or you can look me up on Facebook. I'd be happy to talk with you. But don't disqualify yourself or your patient until you learn more about the gift of hospice.
All right, Michelle, I really want to thank you so much for sharing this information. You've really helped educate our viewers on what hospice is. And as you mentioned, it's not just if you're dying that very minute. Maybe you have a family member who has COPD or heart disease. So that's important information. And also you shared some very crucial information about how COVID-19 has changed the way your workers are doing things, and also the way that people are really hesitant to leave their homes. So I want to thank you again so much. That's Michelle Cook. She joined us via Zoom from Bramwell. Michelle, thank you so much. We appreciate you coming on In Focus and sharing such valuable and educational information with our viewers.
Yes, thank you for having me.
All right, you're very welcome. And I want to let our viewers know, if you ever have an idea for In Focus, you can send me an email. That's mzosh, Z-O-S-H, at WVVA.com. If you'd like to be featured on In Focus, or you have a great idea, send me an email. I'm looking forward to seeing that. Well, that does it for this edition of In Focus. We hope you have a great day. We'll see you again next Sunday.